First of all, thank you, Kathy, for your information and also for all of the central office staff that are in attendance, as well as all the supervisors. We appreciate your participation in today's events. We hope during lunch, I'll put in a plug for this right now, we hope during lunch that you will take the opportunity to mingle and to kind of mix up how you sit. So we would hope that Head Start programs can connect with the supervisors within your area if all possible. We do have table tents for to spur the conversation. However, I'm confident you will spur that conversation on your own as well. But we do have talking points available for you during lunch as well. So with that, we're going to move into some question and answers. We do have about 10 to 15 minutes to pose some questions. If you have questions, please put them on your cards and give them to either Tina or Carolyn, and they'll make sure that they are funneled in this direction. I do have a couple to start us off with. And so the first question is actually both to Clarence and Kathy. Well, you know, you can make it as hard as you want it to be. So, actually, talk to us about the issues. You spoke about the criminal background check. So I think that sparked some thoughts from individuals. So talk to us more about the issues of the criminal background check and how this prevents partnerships and collaboration. I know, Clarence, you kind of spoke about that from a national perspective, how that can prevent some partnerships as it relates to Head Start and potentially childcare. So kind of talk to us a little bit more about that, and then kind of taking it to the next level for both you, Clarence and Kathy, to maybe talk about strategies that you might suggest to help overcome these potential barriers, especially given the current reality with the existing state regulation as it relates to criminal background checks.
All right, can you hear? Oh, let me get this. Okay. Again, as I said in my presentation, for Head Start and with it being a federally oversight, it's not an option in regards to criminal background checks being done prior to hire. That is a federal regulation. We understand that it does have implications because, again, from the Head Start community and many talented folk who you've done an initial interview with may not want to stick around because in what we've heard in many cases, they're also interviewing with other entities. And so they may not want to stick around for the period of time, whatever that time may take, in regards to getting that completed. We've heard that, but unfortunately, that's not a call that we can make. It is what it is, and that is the fact that prior to that hire, that completed process has to take place, and you have to have in hand the results of that background piece. So I'm not sure if I can say any more than.
So Clarence, you kind of described that, and Kathy, kind of within your presentation, you certainly referenced with our state licensing requirement, it's not required to have it completed before those individuals start working in the facility. You also talked about just if we were to change a law, the extensive process that would take to change any regulation, specifically that one. So given that, I'm just wondering, again, hearing kind of the barriers here, if you all have, and Kathy and Clarence, if you have any suggestions to overcome that potential barrier, the disconnect, if you will.
Well, I do want to point out that there is legislation being pending in the legislature right now for national background screening, fingerprinting for child care workers. I'm not sure if it'll go anywhere just because of the cost involved, but I would hope that if that bill moves forward and if we are requiring national fingerprinting, that we then can adjust and include in that statute prior to hiring, and then that would, promulgate, or that would supersede the rule.
Right. Okay, certainly. And next question. I'm going to bring this up, and that's the term quality. And given kind of our conversation around ensuring that all of our children and families are have access to quality programs, and given the current environment, some states are more further along the continuum in having a quality rating system, implementing a quality rating system, and there are some states that are not as far along. I think everyone in this room understands that in Missouri we currently are not participating in a quality rating system. That's a fact. So we have to acknowledge that. It's not a reality for Missouri right now. Given all of that, and because Missouri is not allowed at this particular point in time to implement a quality rating system, just wondering your all's thoughts on how we can, as a state, perhaps at the program level, work to ensure that quality is occurring in our programs, whether that be Head Start, whether that be child care, and whether that be any program that is supporting a child and family. So I'm just wondering if you all have any thoughts, reactions on how we can promote quality, given the current reality that we are not in Missouri implementing a quality rating system.
Well,
I know that's a tough one.
Yeah, I'll just take a stab at it from the standpoint from the Head Start community. First of all, our colleagues out here, you all as our partners who do the day-to-day work, we know that quality goes on a regular routine basis. The unfortunate piece is that we're not sure or clear whether or not your communities know that. And so if there was a suggestion I would give, and that is just to ensure that your communities, when you go back home, that your communities understand and know exactly. And when I say your communities, I know for the most part, Head Start programs do a very, very good job of making sure parents understand that. I don't think there's too many parents that if news people or whatever came out and asked, they're going to give you a raving review. But it's more than that. It's your local chambers of commerce. They need to know that you are providing not only a viable business, because we have Head Start programs, and many of you all are sitting in this room who are in some respect one of the larger employers in that area. They need to understand and know what you do. And the fact that it's not just and I use this term loosely, a glorified babysitting process, that you got qualified staff, doing and providing quality service on a daily basis, from the time whatever time you open. And this will go across the board for child care, from the wraparound services that some of you all provide at 7:00 in the morning to, the Head Start services that go on throughout the bulk of that day, and the wraparound service, the other end of that service as well. That's where I find from a regional program manager, one of the things that I've shared with some of our programs, when I've gone into some areas before I went to that actual site, I've stopped off at a supermarket right next to close by by one of the centers, or visited the fire department, and I've in a sense played dumb and asked them, can you point me in the direction of the Head Start program? And unfortunately, too many times I don't get the right answer. They don't know. I was at one place in the fire department. I think it's that. Yeah, the place over there with the kids. Yeah, I think that's the place. And they were correct. That was the place that they directed me to. But if there was one thing I would just say, let's take the think out of it. They ought to be able to say without a shadow of a doubt, yes, that's a Head Start, and they are fantastic in what they do, because it's those kinds of things that are going to continue to keep Head Start out there on the forefront, and for people and for the community. Because once your communities know that, then we don't have so much of a national debate about the existence or whether or not Head Start should have a place at the table.
And I would agree with Clarence on that. not only educating your community, but your legislators. I would definitely take it. You run into them at the coffee shop, say, hey, this is important. This is not babysitting anymore. And it is educating your legislators who think, well, I went to this provider and, she had 10 kids in her basement all by herself and, I turned out okay. So, there are a lot of educating to do about early childhood development and those kinds of things. One of the things that we have done, and again, you can look within yourself to improve your quality, is that our training approval process. In 2008, I think we approved 208. Angela could give you 208 trainings. Today, we've approved over 2,000 trainings for clock hours. We are trying to review those trainings to make sure that they do provide you with the background that you need. We've also included online training in the last couple of years. I figure if you can go out and get a PhD online, you could probably go out and get some clock hour trainings on early childhood development as well. But those are just a couple of things that I have.
Thank you, Kathy. And I think this is a good segue. We have maybe time for one or two more questions. And it comes back to some training topics, but also I want to get to some of the references around making the inspection reports available online. And so there's a question here. I understand that the inspection reports of individual child care facilities are online for public viewing. Where can these be found?
Oh, it was on the web page that I showed you on the PowerPoint is called Show Me Child Care. It's called the Show Me Child Care portal. You can search by city, you can search by type, you can search by county, and it will list all of those. You can click on that facility and it will pull up that inspection.
Will all of the complaints be posted on the website or only substantiated?
We do not do complaints. We only do inspections. Our goal is to have complaints online. Again, that would only be substantiated, but it's taken us 4 years to get this far. But complaints are in the future.
And then just real quickly, getting to the training piece of that, I think that there might be some lack of information, misunderstanding, just questions around, do Head Start trainings for our staff have to be approved through the Missouri Department of Health and Senior Services?
Yes, they do.
All right. There are many other questions, and I think there are more specific questions. We will have panelists that will be representing kind of the health and safety, sanitation side of it, fire safety, as well as there are some questions around some of the mixed aged regulations, and I think those types of things will be discussed on the panel. So we will hold on to these. If they are not answered, we'll make sure that these are articulated to the panelists as well for their input. With that, I want to take the opportunity to, again, thank both Clarence and Kathy for being here today. I know, especially as it relates to some of the questions being thrown, that can be somewhat challenging, and I appreciate you all, again, sharing information and being open to questions and answers as well. And so on behalf of Head Start and the Head Start Association, we'd like to give you both a little paper holder. I'm missing the term for that, but hopefully Head Start will not be far from you in the work that you do every day. So thank you. We are going to, yes. We're going to now transition to lunch. We do have lunch right outside of the double doors. We'll have an hour for lunch. Again, we plan to put table tents on your table just as a time to maybe engage in discussion with your partners and with child care licensing. Again, we really encourage you to spread out, mingle. I will point out the fact that we did not put color codes on your name tag. We did not make those choices for you because we felt that you could make that choice for yourself. So please use this time to network. And we'll start back up at 12:45.